Yeah, I mean, well, we're seeing, when I'm looking at the death data, I've got it right here. I mean, you still, 51% of our deaths are 75 and older, but 22% are 65 to 74, and 21% are 50 to 64. So, yeah, I mean, they're still going up in those age ranges. So we're, it seems to be that I haven't looked at the data today, but the average age of hospitalizations, especially during the height of Omicron, seem to be getting a little bit younger, and that we saw a little bit younger in the deaths. But this is, I think the moral of the story is, the vaccines. It's the vaccines and boosters. That's what we need that offer that most protection. Well, I would, encourage parents to do just what I'm doing with my children. Talk to your kids about the mask, and almost do like I just do normally in my day to day. Once the mask mandates go away, it'll be my personal choice where and how I feel comfortable. So I believe I'll wear a mask in certain situations where it's not necessarily a hindrance to me, and I'm not necessarily communicating with people, like say going to the grocery store or going somewhere. But then there'll be other places where I'll take my mask off because whether what I'm doing, maybe I'm at the YMCA working out, or I'm somewhere and the group is small, the ventilation is good, and or I know who I'm around. So I think it's going to be just an individual choice. And I think you've heard Dr. Oles say it, and I'll say it. Just because the mask mandates are going away we want people to feel comfortable wearing a mask if they want to wear it. And I would encourage people, especially if they're immune compromised or they are just have concerns, to feel comfortable. There's nothing wrong with choosing to wear a mask all the time or in certain situations where you feel that you're at higher risk. Well, I think, some of it is we're looking at the cases have had this constant decrease over the last few weeks. So the cases are going down. We're seeing that percent positivity is going down. We're seeing the deaths decrease. We're seeing hospitalizations decrease. Also, we know that, vaccine is readily available throughout the community. And also another thing is we're seeing that the medications to treat COVID-19 are available. I was just on that same state call that I mentioned about when we were talking about BA2. That same state call said that last week was the first week that the state supply of pharmaceuticals to treat COVID-19, actually the supply was greater than the demand. So if you remember in the past, there wasn't enough supply to meet the demand. So I think we're coming to sort of a tipping point. But again, I would tell people, to still be careful, to still take caution. And as a parent, if you feel that your kids should wear a mask, then let your kids wear a mask, or let your kids decide, in what situations at school to wear a mask. If it's during class, yes, maybe, but they don't want to wear it outside at recess, because there's a lot less risk outside. So I think it's, teaching your children how to make those decisions. You making those informed decisions about when you feel comfortable wearing a mask and when you don't. So I think those are all, that's where we're getting to, I believe, in the pandemic. It's more about, it's getting to that place of personal responsibility. And you have options now, like I said, with vaccine, with N95 mask, with all of these options.